There you are. Hi.
Yeah. How are you?
Good. How are you doing?
Good, thank you. I'm trying to see if I can get this on Facebook myself, but just forgive me for a second. Okay.
Okay.
All
Well,
good.
thanks for having me on and yourself on to talk about something that's near and dear to both of us, which is hair loss. And you've been in the industry for a long time. In fact, we met each other, I don't know, 6 years ago or so at a
I think about
conference.
that. Yeah.
Yeah. So tell me what you're seeing when you're going in with people who are having hair loss. What is it the main cause that you're noticing that they're coming in with? What type of hair loss?
Actually, I would say more than anything is um, pattern hair loss is
Yeah.
androgenic. I've been, of course, like we all recently been seeing a lot more people noticing the telogen effluvium with after COVID,
Yeah.
which again, or most people are actually getting aware of it, but a lot of people have already had some problem with the female pattern hair loss, but now it's kind of getting more aggravated. So yes,
Yeah.
that getting a lot more. I feel like I see that here coming up.
We're seeing right now in our center is a huge amount of telogen effluvium. And I always tell women, how do you know when you're having hair loss? Because they've been our clients for years and then they're coming in, they're just saying, I feel like I've lost 2/3 of my hair. And they're losing a lot. And one of the things that you can tell is if you've lost overall volume. So we know that genetics usually plays a part where the part line gets wider and wider. We're having that hair loss on the top, the hairs are individually getting finer. But to lose that overall, when you just can see through, the sides are weak. And so just to kind of give a recap real quick on what boosters or vaccinations, what we're seeing is that your body is immediately recognizing that there's an enemy. That's what it is our body is trying to hurry up and go protect ourselves.
Correct.
So it has to pull from our hair, our skin, and our nails. And that's why we're noticing, even after, 8 weeks, 6 weeks after that final booster, you're starting to see some uptick in shedding. It's going to come back. It's just, what do you do in the interim? So there's some topicals and some things that we can do to actually help with igniting that hair to come back, to wake up out of that dormancy stage. But I think the biggest thing is knowing that this type of hair loss, that shedding, is a short-term situation, just like a cancer patient who goes through chemo, that hair will return. But being able to see in areas that you might have had genetic hair loss, it's much slower to grow back in those areas.
I have a question for you on that, which again, a lot of people these days are asking if they already had the underlying androgenetic alopecia with the pattern hair loss, and now they're getting this. Can it just push it to a lot more of a
Mhm.
faster phase, or can it cause it to really come back very slowly or not come back at all?
Well, and that's a great question. We're seeing this accelerate genetic hair loss unless they were doing something to stabilize it. And I think that's the biggest thing, is that the first time you notice a problem, we know 50% has already changed. So if you're already weak up here and now, hey, I've had COVID, I've been in the hospital, or I just got all of my boosters, my hair is going to jettison out, and then it's going to take a lot longer to go into that. So I think number one is, are you on a program already to stabilize the hair loss? And what ways can you use, either topically or injections, to actually hurry up and wake those hairs up to get growing again? But if you're
What
not
is
on anything and you have genetic hair loss, yes, it can accelerate your genetic hair loss because there's nothing to assist it.
And then, like, what do you think the timeline of the hair recovering and coming back? What is the recovery time?
So an average healthy scalp will fall, you'll have maybe a quarter of an inch to a half an inch. So if you have areas that you're actually having an issue, it can be even less. It could be, I don't know, 1/3 of an inch. So really stimulants, minoxidil, any type of scalp topical to help wake and agitate those scalps is going to be really great, because you want to get that hairs and trick them into the growing phase in those specific concerned areas. So a lot of times people think, well, Rogaine, I don't want to use that forever, or I hear you have hair loss after. If you're using a modality to stabilize the loss, these topicals should be a short-term fix to help getting more blood agitation. The whole purpose of Rogaine was to get a hair that's in the anagen phase into, or the catagen phase into an anagen phase. So a dormancy into that growing. The problem is that how do you keep those hairs growing? And that's where you have to do prescription grade lasers, or we get you on a Propecia, something to stabilize. But minoxidil by itself is about 10% effective in slowing down the hair loss. So we really use it as an adjutant and a booster versus a way to stop hair loss.
Okay, actually, then you answer my next question on that. Again, that was about minoxidil. I have another question personally, because as far as I was aware of, the Propecia was only prescribed to men. I see most recent years, I've seen it getting prescribed to women. What are your thoughts on that one?
Well, DHT is produced all over our bodies. It's in our skin, our liver, our adrenal glands, our ovaries. So men, the type of DHT that causes hair loss for men, a lot of it is produced out of the testicles. So that's how we've known a prostate drug would help with their hair loss. For women, we break it down all over, and we do not have a way to stop that. That's why when we finally got prescription grade lasers, we can actually open up the blood vessels and dilute it out. And so some cases, doctors will prescribe, if you're postmenopausal, a type of finasteride or Propecia, because there can have some benefit. But again, it's only slowing down. And then there's multiple ways they're still going to be breaking that down. So to get on a prescription where it's just going to maybe slow it down, a lot of women don't even decide that they want to go that route. But it does help in some instances, but very small amount just in slowing it down. Because really you want to be past the childbearing age to be able to even get on something like that.
Very actually recently, I had I believe she was 17 or 18 years old, that was on Accutane.
Mm-hmm.
Lost a lot of hair, but the physician actually gave her Propecia.
Yeah.
And that's what I don't know. And that was where, like, I didn't know if that's even possible.
Yeah, I mean, really, the physician is gonna, they have to see what's best suited for them and what their clients are. We particularly, our office won't do that, but DHT causes two things in the body: acne and hair loss. So we really see that those two things are very much linked. And what I find funny is that our age demographic has moved so much that a majority of our clients are 12 to 40 years old right now. So we're seeing more kids that are getting just out of high school with a significant amount of hair loss. Why? Because look at what our kids are exposed to now. I mean, the foods, the environment, all of the different types of EMFs. By the time our immune system is so depleted, by the time we're even graduating high school, your body is trying to pull from every area. So your hair really suffers. Again, you're going to have a genetic hair loss, whether that's what you're born with, but are you going to have it in your 30s and 40s and 50s or in your teens because of how depleted your system is? So, some of what we've done, and I know that you've looked into too, is the genetic testing, where we can actually take the cells and you can actually test to see what are you nutritionally deficient in, what is going on in your system, because a hair follicle itself, the tissue in it, it gives you 90 days of information, whereas blood work's going to give us a couple days. But this is going to give us almost 40 pages of information: immune system, hormones. If you can solve a murder with a hair follicle, imagine what we can find in the DNA. So those things, we're finding gut is so related to accelerated hair loss. Even if you're in a virus state, if you're post-virus. So there's a lot of things that we can do now that can naturally help build you up in your system versus having to get you on a prescription.
What about supplements and vitamins? What are your, look at that, that's what another thing I see most people
Nutrafol, Vitascal, Sol Palmetto, and I think those are all fantastic vitamins. But I just had a conversation with a patient last night about this, and she's been throwing everything at the wall, and she's been my client for years. And then all of a sudden she lost a massive amount of hair. And at the end of the conversation, I said, by the way, did you get boosted? And she goes, yeah, I just had my fourth one. And I said, was it, in April or whenever it was? And she said, yes. I said, that's probably what's going on. It's not that these are bad. It's just that your system, this is 4 shots in a short amount of period of time that we're seeing these clients have a huge uptick. So for me to sit there and go, let's get Viviscal, no, let's check your hair, see what you particularly are lacking. And all of these specific supplements, okay, she was low in vitamin B9, B12, C, and then we looked in multiple areas. Can we get her to eat food that are highly enriched in those versus giving her more supplements? That's what I'm more concerned about, is how can we? Because do you know how many times we have clients who come in with a bag of vitamins,
Correct.
and at some point it's just expensive urine, right? Because your body can only absorb so much. So I'd rather know, hey, there's 3 things that popped up all throughout this report that you're really lacking. These would probably be the most important things. In these vitamins that are out there for hair loss, they're just generic, and she could be lacking absolutely nothing in there. And so that's why we say, let's just get this to what you need, because the more your immune system is built up, it's not going to pull from your hair as much. And that's going to help the whole situation.
Miss Carly, would you please explain that to my audience, our followers, that what do you guys do with, what do you recommend? How do you find out what are you deficient, and what is that DNA testing? So it was actually something for me kind of recent last year at the American Hair Loss Council.
Yeah.
And it was amazing. I mean, I was just amazed with the results
Yeah.
and all the things that I got. So it was very interesting. So if you can elaborate on that, that would be great.
It's very interesting. So, and we'll be at the American Hair Loss Council again here in North Carolina. I think it's September 9th and 10th, and we'll be lecturing over there too. So I hope that you're going, and I can see you.
That
Okay,
is like,
good.
that is that one event that I'm truly looking forward to. Yes.
I know it's a great event to learn about hair loss, but the epigenetic testing is basically where you'll find now more and more that there's places, hey, I can take a clipping of hair and send it. But this, how much has this been exposed to? Everything that's going on. So the testing that we do is you actually have to pull some of the hairs, and you'll notice it looks like a root, but it's not. It's a secondary, and there's a white piece of film around it, and that's really what we're testing. And it will tell us if you've got some exposures to metals, to EMFs, if all of the nutritional deficiencies, if you've got bacteria, fungus, parasites. We have a lot of children that we test that have had blood work, and they have huge patches of hair loss. And I had one little girl, they flew out from California, and she was riddled with parasites. We made some changes, and she's not had a flare-up since. So it really allows us, and then also the 400 foods that we test, because intolerances are those little secret things that, you feel tired or bloated, but you don't have a reaction like an allergy. So you really don't know what it is. And this will tell us not only what you're sensitive to, but genetically what your body would not do well. Because some of these foods you might have said, I've never eaten, but your family, it wouldn't do well with your system. And so this just helps us guide our clients to the specialists that they might need. If it's hormones that's popping up, now instead of us going to our family doctor and all these other ones, we can say, let's just go work with your hormonal your doctor, because this is showing up. But I think it's a great way to customize a treatment plan for the client versus us giving generic treatment protocols and saying, I hope this is what's working, because a lot of it is stuff that it's those silent little aggressors that we don't even know that are lurking around.
And do people need to be in Arizona to get that tested?
No, it finally got packaging that you're able to seal it where it stays contained, because that was the biggest thing, is how do you not get it compromised? So now these can get mailed to the house, and then you'll have a specialist who will read it for an hour with you, depending on which one. And now, even like for you, all of your clients can get the ones that affect just their hair, skin, and nails. So we have
Well,
the immune report and
I
that.
can't wait. I mean, I've been talking about it all since last year, and I'm just so excited to have that available right now to be able to take care of the guest.
Yeah.
I can talk about this and ask you 1,000 questions. So hopefully we'll do this in a series. But there is recently I've had a lot of our guests that and younger girls and younger women who have trich, and that they've dealt with it, whether from very, very young age in childhood, or they're actually their middle age right now.
Yeah.
The hair that hasn't been coming back due to excessive pulling, because I
Yes.
know, again, when you pull it a couple times or 2 or 3, maybe comes back, but what does it cause it to not come back, or is that a chance for them to recover that hair?
Yeah, no, that's a great question. And I work a lot with Hannah Reed, who's a big advocate on
Oh my
trichotillomania. And
God,
so we'd
she's
love to have her as a
beautiful.
guest too. And we did just get a message. We got a New Jersey hairstylist who has androgenic alopecia, and she'd like to do the testing. You can go ahead and shoot us a message, and we'll get that information over to you. Trichotillomania is an issue that we see a lot nowadays because people don't know how to handle stress. And so once you do pull out in that area for years and years, you can eventually pull out the follicles altogether. So, you know, really what we always suggest is the biggest thing is we need to get them some counseling, right? Because we got to figure out how we can help this individual when it comes to having ways to process stress or anxiety. Maybe there's been some past trauma. And sometimes they have to just get a wig or a topper or something so they physically can't touch it. But I think that having a whole series on this would be great. And I think we could even have, like I said, Hannah, who can really speak to that. But I think first thing with trichotillomania we've always done is just really worked with a counselor in that area that specializes in trich, because that is a specific, unique niche that comes with something like that. And so we can get a list of people, Zoya, so that you can have that too, where you can do a Zoom or something with some of these counselors.
I would love that, because again, there's just so much we can do on our end, but that as the problem goes a little bit deeper. But again, just kind of piggyback on that question again, after a few years, do they have it, like if it's looking like it's not coming back, was already thinned out, is that a chance for them to recover their hair? Or once the follicle,
I would look at their hair under the microscope. Look at their hair under the microscope to see. I mean, I've worked on people who have lost it just due to telogen effluvium for 7-8 years, and then we get hair to come back. So, you know, it really just depends. How long has it been since they haven't actually touched that area? With trichotillomania, is it been that one spot constantly, or, you know, that's kind of where we have to see that. So making sure that that's an area that stays totally untouched. I'd recommend them getting on some like niacinamide with the minoxidil, some kind of topical to help agitate and wake up any dormant hairs. And then maybe some laser therapy. And then that way you can just check, take some microscopic photos, and then in 6 months, take some more microscopic photos to see, because there can be a lot that go into that dormancy. Trichotillomania many times can be in different parts of the area. So it just depends on how, you know.
I am so sorry. I've got 3 dogs jumping on top of each other. Give me just 1 second. If I hold on to one of them, I get the other 2 to hug.
And then I have Airy Blake. What about PRP? PRP is great. It depends on what type. I always suggest a therapeutic type of PRP, where you're double spinning it. There's also PRP Super Shock that there's where you can extrapolate your own exosomes. But PRP and anything like that is really boosters. So again, why are you using PRP? Do you have genetic hair loss? How are you stabilizing that before we go and put fertilizer in that scalp? And that's why I find a lot of people who go get these injectables find that, gosh, I didn't see a big result. Well, it's because we got everything to grow, but then we didn't continue to feed it. And so that's why usually when you do something like PRP, you have to do a combination therapy. It's not just a, you know, let's do a couple PRPs and it's over. So we need to know if it's a disease or if it's just a short-term shed. So I would submit some photos so we can see exactly what type of hair loss you're experiencing to see if that PRP is the right fit.
As far as the protocol, what would you say the sequence of the treatment would be? Where, like, someone come into what would say and have hair loss, and you would think it's a combination of telogen effluvium. Some of it would be just androgenic. Where do you start, and what, if you would say, just kind of quickly explain all the options without really knowing exactly what it is? What would be, how many options would it be available that is truly approved? And
so first thing is first, if you have genetic hair loss, we look for two things to know that they truly have it. If you feel back here by your occipital bone, that's where you're the healthiest. So if you have hormonal hair loss, you have PCOS, whatever it is, your hair right up here where you're losing it would look like this everywhere. So most women come to me thinking they have something totally opposite than what they actually do. So I always say, feel your hair back here and then feel your hair over here. Do you feel like it's finer? Then you know that that's genetics, because the hair gets finer and finer and finer when you have genetics. Okay. Right. And then the pattern is the next way. Women who have hair loss, they keep their hairline right behind it is where it starts to thin. And then it just gets more and more diffuse, and then the sides can get thin. So when we look at that for women, then we know that it's something like that. Now, if they're shedding and they're washing their hair every day, every other day, and they're having tons coming out, how we're going to help their genetic hair loss is going to also help them with their telogen effluvium. So the first thing I would do is scope them to see if they have an abundant amount of miniaturized hairs, those fine hairs. And then I would probably do that epigenetic testing, because I want to find out what is going on in the system to cause them to have that fallout, that shedding. Okay. Then we would get them on something to stabilize the loss. And after we worked on that for about 90 days, then we could talk about boosters to get those hairs to grow back faster. But you've got to be very consistent and do it in a specific way. People who go all over the place, they don't see results because they're not doing it in the right order. So again, what is telogen effluvium? I think a lot of people think they're going into shot glass and have this, but most of the time when you start losing your hair, you stop doing what? Washing your hair. Washing your hair. So every time you wash your hair, it's like a bigger and a bigger clump. So you have to remember, when you have androgenic alopecia, you have to wash your hair more, because you've got buildup, you've got dead skin, you've got oils, and there's pits all over your scalp that all this dirt and debris is getting lodged into. So you need to make sure that you wash that off. So every other day is totally fine, but just realize every day 50 to 100 hairs have to come out. If they're not shedding, you're not growing. So you have to have hairs falling out. But if you wait 3 days, now you're gonna have 3 times the amount of hair falling out. So it's just important that we realize this, because we panic because every hair is like a piece of gold. It's just that replacement is so darn slow and growing that we're like, I need my hair back yesterday. So that's why we want to make sure that we're telling our clients the right tips and techniques to take care of their hair.
That is so exciting that I'll have you again. It's, even though I have been in the industry for a while, but just being able to just ask you more questions and be more detailed about every specific situation. I'm so excited, and I'm so grateful to be able to chat with you about this.
Oh, hopefully next time
I don't have all this distraction today. It just happens to be a little bit off. But thank you, Miss Carly. I would love us to, again, I have several questions. I don't want to take so much of your time, but if we can just set up some time and get some of my audience submit questions, and we can get you to answer those and get some help, we can get all the women happy. So
yeah, I love it. And I think, you know, the summer series, what I'd love to do is go through commonly asked questions, like when you're in the chair, what are people, you know, what kind of extensions are good when you're losing your hair, and rotating extensions, and, you know, what are the topicals that you can maybe use around there, because, you know, that's what we're finding a lot, COVID hair loss, and now we're going to go put in a ton of extensions, and then we have issues with that. So there's, you know, we want extensions, but there's a way of doing that. So we will start promoting and talk about the next top questions that we want to go through. And then that way, if they have any questions, they can email you directly, and then we'd be happy to do a team approach to kind of see what would be best suited for your clients.
That would be great. I'm so excited. Yeah, we have actually been working on a 3-step methodology that we have as far as we say, analyze, stabilize, and then enhance. Most people, again, they come with the sequence of it backwards, and they come in, they're like, well, I want extensions, or I want toppers, or I want this. And I'm like, you can't. Let's figure out what it is, because you have to have hair to attach extensions.
Exactly.
So, and then you don't want to get the excessive hair loss and all these horrific stories about extensions. So I am totally pro definitely figuring out what it is, and then strengthening the hair before you start enhancing it. So
I think that's the biggest thing. And people want that. We all want, you know, yesterday our hair back, but I always say to clients, what are you going to look like in 5 years if we don't do something?
Exactly.
Okay, so yes, we want to stabilize. We will make you look beautiful. We'll get everything you need. But if we don't stop this, you're not going to have, you know, the choice of wearing a wig when you want to. That's all you're going to, or you're not going to have the choice to even wear extensions. So let's look short term and figure out how we can do this now, and then get you on the right, you know, extensions and products. So I love that. I think we lost Zoya, but if anybody does have any questions while we're doing this, or you have hair loss concerns yourself, go ahead and you can shoot us an email or a message on Instagram, and I'd be happy to review any tips